Hi, welcome to this episode of Herald Cafe. Today we've got a very special guest, Gabriel Pereira.
Thank you.
Thank you for your time to come here. And to the audience, what I want to tell you that Gabriel is doing something very important. He's creating awareness amongst people for organ donation.
Yes.
First, I would like to ask you, what motivated you to start this
Actually,
initiative? Yeah, please.
it was 6 years back because of my sister-in-law's kidney transplant. I came to know about, I said, my wife was a potential organ donor for
Okay.
her sister.
Mm.
And because of her illnesses, that she is a pressure hypertension person, so doctors advised that she would not be a good candidate to donate.
Mhm.
Then her husband only came forward and he donated.
Mhm.
So that triggered me to see after the transplant. Now 6 years back, she is already doing well.
Mhm.
Husband is also doing well.
Mhm.
So I said, let's see what is the scene in Goa.
Mhm.
I'm
Yes.
talking 6 years back.
Yes,
But
sure.
it was fairly new. The concept was not started. There was no Soto in Goa at that point of it time. And then I did my research on the net to see where I could, how I could help the people of Goa.
Mm.
I sent a lot of mails to a lot of NGOs throughout the country, and then Mohan Foundation, they sent me this thing, and we interacted and we sent out mails, and they did allowed me to do a training session with them. They sent me all the tools which are necessary to do awareness programs,
Okay, okay.
and that's the way I started my journey.
So, since Goa is such a small state, and in compared to the all across India, do you have any statistics of how many organs gets transplanted or something? Like how do you measure your success? How do you?
See, organ donation is very new to Goa.
Okay.
Okay, now we have the SOTO in place, which handles the waiting list allocation. We have around 45 people on the waiting list.
This is in GMC.
In GMC, yeah.
Huh.
So now we had, in fact, yesterday only we had a Naman Divas, which was for the dedicated for the family who have donated their loved ones' organs to the this thing. So I'm looking at another 5 years down the line, probably, which people we can create awareness with your help also. And wherever I do organ donation talks in schools and all, I need the help of the community where I can spread it out more to the public.
So, what kind of resistance do you feel? Because organ donation is very intimate, very personal, and maybe people do not have when the eye donation was happening, people will thought that they will gouge the eye out, and it
Yes,
will be
yes.
like that. Actually, it's the retina that comes
Yeah,
out.
it's the cornea.
Yeah, only the cornea that comes out. So those kind of because of those kind of I'm not saying misinformation. The information is not there. The access to information
Yes,
is not
yes.
there. So that is why people may be reluctant.
People are little, the awareness is the most important thing. People should understand what is coma, what is brainstem death, how is the brainstem death declaration done. So a person who passes away at home due to cardiac death because of his heart stops beating, he can be a donor for tissues, that is eyes
Okay.
and skin.
Okay.
Then he can do a whole body donation, which the body could be utilized for medical purposes. If a person lands up due to an accident or brain hemorrhage, the person is in the hospital. The person is in the casualty. The doctors will try to take care first. When he's in the casualty, they'll try to save the person's life due to the accident.
Yes.
And then if they find that the person is not responding to medication, probably they might do a test to declare the person in brain death. So there is a specific test done
Okay.
6 hours apart
Okay.
to really determine that that person is brain death. So brain death is a legal certification of death.
Got it. Yes.
So that circumstances, a person can donate up to 8 organs and enhance life of 50 people to tissue donation. So a
Okay.
person who passes away at home cannot be an organ donor.
I didn't understand why not.
So because see, when a person is in the when he is in the
Yes.
ICU,
Yes.
he is declared brain death.
Yes.
His brain actually is not is dead.
Yes.
He is legally dead. So there's no
Yes.
functioning. The brain is not giving any command for any for the vital organs
Respirations
to
or anything. Yes.
respiration is taking place. Blood is flowing due to the person on the ventilator.
Got it.
So the law doesn't permit us to unplug that person. So eventually the heart will stop pumping in a day or two, maximum 5 days. So you're depriving a person who needs a ventilator if the declaration of brain death is done.
Got it.
So now it's because we know in COVID times we required ventilators. Now even when people need, diagnosed because of dengue or malaria, they might require a ventilator. So if a person who is declared brain death and they are keeping him on ventilator,
we are denying.
we are denying
people,
another person. So a process of the team of doctors are there in all the hospitals which are licensed, approved to do transplant and retrieval. They are authorized state a panel of doctors which are.
I was just thinking that if it's very grieving kind of a situation for the family also, no? Because if there's lack of awareness, they will
Yes.
not know how it can be done. You know.
That's right.
Any examples of resistance that you can tell us?
See, my
any important.
as my mission is like to do awareness programs and reach out to the public. So in their lifetime, they understand the concept of the brain death, then how the procedure goes on. So they can tell it to the family. So once they reach up in that, they'll end up in that situation. It's more easier because they have probably might have told their family, okay, what is organ donation, how the process of brain death works. So it becomes easier at that stage. See, for the transplant coordinator or the grief counselor, I am looking at least 50-60% less at that moment. It becomes easier for the family also to understand. So it's one thing like when person pledges to donate organs,
Yes.
he has to tell his family. When I have my workshops or my organ donation talks, there is the entire family is not there. It's only one person who's attending.
And who? Yeah. And they have to get consent. You have to take consent.
Yeah,
from
family's
everybody.
consent is a must for
Yes,
organ. You
of
might have a organ donation card with you.
Okay.
But as in India, we follow opt-in policy where the family has to say yes to organ donation.
Okay.
If they don't give the consent, the organ donation process will not go ahead.
Okay.
So as a person who attends the workshop of organ donation, he has to take the message back to his family. So I am just creating the awareness, but then they have to take it out to their family. I always tell my audience, if they still are not confident, you can call me. I'm always available.
Okay.
And to
And Gabriel, what are the infrastructural facilities we have in Goa for if something happens, if somebody wants to donate their heart or like?
see, presently in Goa, we are doing only kidney transplants.
Okay.
So we have Goa Medical College, we have Healthway, Manipal, and we have ASG. So basically, GMC, Healthway, Manipal are doing kidney transplants. Again, Healthway and ASG does cornea transplants. So once upon it was only Goa Medical College which was doing transplants. Now we have the private sectors also. So
And for the eye, for what is the most donated organ of the
I can feel the cornea donation is the most easiest which could be
Okay.
done.
Huh.
There are parts, because there are a lot of people who pass away at home.
Hmm.
So they can be potential cornea donation donors. They can be whole body donors. Because I assist the public to commit yourself or pledge for whole body also, because it can be utilized for the educational for the
Medical
MBBS
purpose, yes.
MBBS doctors who are
Yeah,
there in Goa
yes,
Medical College.
yes.
Because that could be a this thing, because they for them to use a body given out of willingness is always better than to unclean bodies which are with medical legal cases. It becomes difficult for them to adapt. So person does a willingness, it's a declaration come will which we assist. I do assist
Okay.
people
Okay.
and take it.
And we have a population of around 20 lakhs
20
people, and do you have a database of how many people are in your donor list? Do like a lakh of people?
In Goa, basically there are 45 people waiting for kidney transplants.
That's a huge list.
Yeah, 45 is a huge list. But
yeah.
what happens? The people are not consenting. The lack of awareness is not there. So I am looking at, as I mentioned, 5 years down the line, probably because previously blood donation was a very new concept. People are not coming. Today there are a lot of blood donation camps happening in schools, colleges, in clubs are happening, and people are coming. If one person is telling his 10 friends to come, we'll go for blood donation. So in future this will take place. People will say, okay, come. If like you have understood the concept, you tell another 10, well, why don't you do a organ donation? Pledge for organ. We don't know what is going to be. As I always say, we should be fortunate enough to be organ donors.
Yeah, to help other people.
Yeah, because I pledged. I don't know if I will be a brain death or I might pass away at home. But if I pass away at home, at least my eyes and my body could be utilized. So I don't want it to be just buried, which will not be used for.
Got it. And what kind of awareness drives do you do? Do you do it in the schools and colleges or the clubs? How do you
Yes,
go
presently I am doing it in schools, colleges, in clubs, in Lions Club. Sometimes I put up this pop-up bazaars are there in the market. So there I put up a information desk. Then in the blood donation camps, there I put. So my setup for a blood donation camp is basically LCD display where a scroll of videos of what is brain death, how is the process of allocation and all that has been played. Then I give a flyer. Can I show this?
Yes, yes.
I give this flyer. It's basically frequently asked questions which are there. Normally frequently asked questions mentioned in this. So this I hand it out to the people.
So do you think that medical fraternity, the doctors will be your allies mostly in this, because the doctors are the first point of contact after anything happens?
Yes, yes. The doctors actually, see, end of the day when a person is brought to the hospital in the casualty, the doctors will try to save the person's life.
Yes.
The person is then taken to the ICU if there's an operation needed. Then that's the time the doctors will try to see how is the patient responding to medication. If they find out like he's not responding, then probably they'll try to do the test for determining a brain death. Just before that, they might try and counsel the family. Grief counselor might come aboard and try to make the family aware. Okay, would you be interested in organ donation?
Right.
But first, the primary fact is that doctors will try to save the person's life.
Yeah.
Nobody wants a person to to retrieve just because to harm the person.
Of course, of course.
So that is this.
So I think every hospital should have grief counselors like that who can educate people.
Yes, yes. Most of the hospitals have grief. Yes, they have grief counselors. They have transplant coordinators which are there.
Okay.
So they will get in touch with the family, try to convince them for organ donation. But as I mentioned, in Goa or in India, we follow opt-in policy, where the family's consent is a must.
Okay.
The family with the free will should say yes, I want to donate.
But to reach to that stage also, the family should be aware of all these things.
That's where we come into play.
Right.
Having awareness programs at wherever. Now I've done close to 50 awareness talks in Goa, in schools, colleges.
In remote areas also.
Remote areas also.
Yeah.
I also do awareness talks with SOTO.
Okay.
That is the state organ tissue transplant organization.
Got it, yes.
I take them on board also. The doctors from Healthway, doctors from Manipal. So it's not, the purpose is not because of any private sector or government sector.
Got it.
The mission is our Goans should understand what is brain death, why we need to donate organs. So those things. So the mission is to educate our people of Goa.
True.
So because we have a lot of people who are on dialysis presently. So we don't know if there will be good patients for a transplant.
Got it.
But awareness is the most important thing.
Great. I think you are doing a really good job, and people should understand also that to live beyond self.
Yes, yes.
That is. So I think we are coming to an end of this conversation. I would like to know in the end any message to the Goans to not to excite them, just to let them, give them awareness about why it is necessary, like why people should come forward.
Yes, I would say, like, always one can pledge to be an organ donor.
Mm-hmm.
You can always get in touch with me, where I can come to your homes, because I do awareness programs in complexes also.
Mm-hmm.
So where people can understand what is organ donation, why we have to organ. We are around 45 people on the waiting list at present. So we have to help those 45 people.
Yes.
Eventually more people will be. Today these are lifestyle sicknesses, which are hypertension, diabetes
yeah.
are on the rise. So we have to help people. So what is a better way of helping? To understand the concept of organ donation, say yes, pledge. Today when you go for a driving license, our state government has done a unique thing of keeping the
Blood
form
group.
2.
Okay.
On the form 2 driving
Yeah.
license, you can tick.
Yes.
For on your driving license, you will get a small heart and that I'm an organ donor. No need of carrying the full organ donor card with you.
Got it.
So that is one initiative done by the state government. And there are many ways of pledging. You can take a donor card. Even the Aadhaar card now, the Prime Minister of India has linked the Aadhaar card with the donor card.
Okay.
So these processes can be done. But side by side, when a person is pledging to donate, he has to tell his family. See that at least once a year he tells his family and friends that my wish is to donate.
Yes, true. Gabriel, lastly, if somebody wants to donate, if somebody wants to get in touch with you, can I give your mail ID and your phone number in our comment section?
Yes,
Yeah?
there is one toll-free number which is mentioned here.
Okay. Okay.
This is Pan India, so
Okay.
I normally give out this. So
Okay.
even if my mobile is not reachable,
Yes.
they can contact on this. So
Got
it is in all the languages which are in India, and if it comes to Goa, then it will be forwarded to me.
Okay.
So
okay.
that's more convenient
Okay.
for for people to.
Okay. And then yeah, I will put this up in that
Yes.
in the comment section. Thank you for your time.
Thank you
and
very much.
all the best for your
Thank you,
good
sir.
work.
Yeah. Thank you.
Yes, audience, it was lovely talking to Gabriel and gets inspiration
Thank you.
for his work. I will see you next week. Thank you.